CCalm Skin Care. I am one of the head dermatologists here at the clinic. You can call me Lucy though. Now, could I just take your name? Wonderful. Let me see. Yes, could I just confirm your date of birth, please? Perfect, this is you. It's always good to start with the right person. So, okay, you are new to us here. Perfect, and don't have a reason here as to why you booked to see us. So why don't you tell me just briefly why you decided to make this appointment? I see. Of course, I think having peace of mind that everything is okay is just such a lovely feeling. And of course, if we do have any causes for concern, then I can talk you through those. And I always believe it's better to be safe than sorry. So, why don't we just start by going through any areas that you think may be worth an extra look at. Now, today I will just be analysing all of your skin. Okay, so in a moment I will ask you to just go behind that little screen there and change into a gown. Are you comfortable doing that? Perfect. You can of course keep underwear on, that's fine. But all I'm going to be doing is taking a look at your skin and making any notes of things that we may want to look at further. Most of the time, unless people are experiencing other symptoms, most of the time we do find that our patients come with a clean bill of health, as I'm sure you will today. But as I say, it's always good to know. Absolutely. So, as I say, very simple, just all over examination today. But why don't you just tell me, do you have any areas that perhaps you're a little bit concerned about, or any areas that have cropped up over the past few months or sooner? Yes. So things like any unusual moles, freckles, rashes, discoloration, anything like that? Yes. Okay. And whereabouts was that? Just here. Okay. And when did you first notice that? Okay, lovely. Can I also ask, have you been to see anyone about this previously? I know this is the first time you're coming to us, but have you been to the doctors at all or any other clinic? No. Okay, that's absolutely fine. I just like to check. Okay, and any other issues? Yes. Yes. Okay. Okay, and any other areas? Yes. Yes, I will be checking all of those areas, that's fine. When did you notice that? Yeah, okay. Would you say that you get quite a lot of sun exposure, weather dependent, of course? Yes. Say on a weekend, a day when you're not working, and it was a lovely day outside. Would you typically be enjoying the sun all day outside, or are you more of an inside person? Yes. Okay, so you would be quite exposed. Okay. What we'll do is, after we've had a little exam, what we will do is just discuss some things that we can do to prevent sun exposure. And the sun is honestly one of the worst causes of all these types of skin things, so I will tell you how to protect yourself, don't worry. Alright then, any other areas at all? Yes. Just there, I can see it. Yeah, no problem, I'll take a look at that. Is that a new one? Yeah, okay. I know it's quite difficult, isn't it, I suppose, unless you spend a lot of time just staring at yourself in the mirror. It is quite difficult to know when things have cropped up. Definitely. What I say to everyone who comes to see me is it's worth just having a little check every now and then, even if it's once a month, just having a little look, just to see if anything's changed. And that can be a really good way just to keep note of what's going on. Alright? So, I'm going to pop this down now. And what I would like you to do, as I mentioned, is just to step behind that screen and you'll find a gown. As I say, keep your underwear on, or if you have a vest on or anything like that, keep that on just as long as your arms, your stomach area and your legs can be easily accessed. Okay, I'm going to get my latex free gloves on, and then when you're ready, just pop out. Okay. There is also a jug of water behind there, you'll probably notice, so if you did want a glass of water or anything, just help yourself. Lovely. Okay, comfy. I know it feels a bit odd, doesn't it? I know. Well, let's get started, okay? I think what I'm going to do is just start with your face and work my way down. Are you happy with that? Wonderful, okay. Let me come a little bit closer then and we can begin. Okay, all ready? Good. So I'm just going to have a little feel. Okay, see if I can feel anything under the skin that may not feel quite right, and just observe. Okay, so they are quite warm, aren't they? I know some gloves can be so cold, but these ones are actually quite warm. Okay. Do you suffer with anything like acne, any skin problems like rosacea or anything? No, eczema? Okay. And on your face at the moment, do you have any skin treatments at all? Okay. No, that's fine, that's fine. I always say that if you do have any medical or prescription things that you would put on your face or on your body, please come and see me with them on, because that is how your skin normally is. So I judge as I see. Okay. I'm normally in my white coat, but the weather is so warm out today. It is. Have you been able to enjoy it at all, or have you just taken a little time off from work or studying? That's lovely. Now, I have been cooped up in here today, but I don't mind. Okay, perfect. I'm going to move down onto the neck and shoulder region. Okay. When you are out in the sun, do you tend to use any sun protector at all? Okay. I'm noticing a little bit of redness here. Do you have any allergies at all? You've just got a bit of hay fever at the moment. Okay. Sometimes sufferers of hay fever can find that they can get rashes in other places. Normally it's around the face area, swelling of the eyes, sinuses, things like that. But okay. And do you take anything for that? Okay. Let's move on to the shoulders. You can hear the birds, I know, honestly, tweeting away in the sunshine. Okay. Do you find you get any areas of dryness, itchiness? Okay. Moving on to the chest area. Okay, you happy for me to do that? Great. Promise I'll be nice and gentle. can see, yeah, I can see where you mentioned. Okay. When you do sit out in the sun, what time of day would you say you tend to sit out the most? I know it can be difficult to remember. The only reason I ask is the sun is at its highest and hottest around midday, so obviously you need to make sure you're protecting yourself, especially perhaps even with a higher SPF at that time of day. Okay, lovely. So now I'm going to move on to the stomach. Okay, so lovely, thank you. Let's just have a little look. So stomach's looking pretty clear, I can see even without touching it. Would you mind just swiveling to the side for me? Okay, and back to the middle, that's fine. Okay. You mentioned this here. Yeah. Yeah, okay. Have you felt any pain or discomfort with any area of your skin? No. Okay, that's good. Now I'm going to move down to the leg area. Okay, so all I'm going to do is just quickly observe. I know you didn't mention anything in that region, but I'm just going to have a quick look. Okay, perfect. Okay, I'm not seeing anything. Just checking down the left leg. And moving down the right leg, checking front and back as you can feel. Okay. Okay, so nothing is a concern for me in that area. So I'm going to take a look at your arms now. Okay, so let's have a look. Okay. Yeah, I can see what you mean. Does it hurt if I just do this? No. Okay, great. Let's just move down. Just turn your arm slightly there. Great, quick look at your hand. Lovely, okay, and the other arm. Lovely, okay. So, you mentioned there's area here. If I just do this, any pain or discomfort? No, good, okay. Let's work our way down. Lovely. Okay, not seeing anything. Okay, great. Now what I'd like you to do, if you could just turn around for me, and I'll just take a look across the back of your shoulders and your back. Alright. If I just do this, could you tell me if it feels uncomfortable? Okay. Just moving down, having a little look. Lovely, back looks pretty clear. Okay. Great, you can turn back towards me now. All right, you'll be pleased to know that you are all done. Just take these gloves off. Okay, so let me just make some notes. Why don't you pop back behind the screen, pop your clothes back on, and join me when you're ready. Great. That's fine, just hang it back on the hook. Thanks. That's okay. No. Take your time. There is no need to rush. Oh, okay. So, how did you find that? It's really simple. If I had found anything to be concerned about, all I would have done is take a closer look at it with a little magnification tool that I've got, and if we did need to do any biopsies or anything, then we would be discussing that. However, your skin is perfectly healthy and fine. So let's just go over some of the areas that you are a little more concerned about. So the pigmentation that you mentioned, as you did talk about your exposure to the sun, it is most likely due to that. Okay, it can occur due to aging as well, but the sun is one of the biggest causes of this. As an example, things like freckles are another example of this. So my freckles do come out in the sun, okay, and that means that I need to take extra care when I'm out in the sun by applying a really good sunscreen. Okay, now typically sunblock will block out the rays completely. So whether you use a sunblock or a sunscreen, you need to be looking out for ones that have UVA and UVB. Okay, so that's the both types of rays, and you want to look for a high star rating. Okay, so sometimes you can actually purchase them in really inexpensive shops. Just make sure that you look to make sure they block both of those rays and they're of that high star rating. Okay, now if you are using something like a sunscreen, you need to be reapplying it, okay, based on the number on the front. Did you know that? that is a common mistake. It is. And before I actually got into this line of work, that is actually something that I thought myself. So if you see a factor 30, for example, you think, oh, that's quite high, I'll pop that on and that's going to protect me throughout the day. No, all that means is that you need to be reapplying that every 30 minutes. Yes, so if you had a factor 15, it means you need to reapply every 15 minutes. 40, 50, all things like that. You just take it as the time that you need to reapply. Okay, so obviously the higher you go for, the better. And it doesn't stop you tanning, it just is going to stop you burning, and it's going to stop any of those nasty unwanted changes. Okay, changes to moles, all things like that. Okay, now another thing that you talked about was just this area here. Yeah, that I honestly think is due to dryness. Yeah, can you just see, just got a bit of flakiness there. Often when we don't apply enough moisture to the skin, it can just dry out. So do you use any moisturiser at the moment? Yes. Okay, that's fine, that's fine. What I would say is try and find perhaps one that contains urea. Is quite good. Normally that's excellent if you've got things like cracked or dry heels, but it can also be applied topically to areas like that. Alternatively, just make sure you're looking out for one that says ultra moisturising, or for dry skin, things like cocoa butter, very good. So just have a little look around in your local drugstore and you will find a cream that I promise will sort that out. Okay, now what were the other areas? Yes, you just have a couple of skin tags you're a little bit worried about. Yeah, they are perfectly common occurrences, and sometimes people are born with them, sometimes they develop. We can remove them for you. Yours aren't in particularly dominant places. Normally, the people who choose to have them removed, they are in quite visible areas. It's a very simple procedure if you did want it done. Do you think that is something you'd be interested in? No. As I say, it's purely a cosmetic thing if you did want that done, but it's totally up to you. Okay, and you mentioned a mole that you're a little bit worried about as well. I can see no cause for concern there. So the types of things you want to look out for with moles are any changes in shape or colour, if they start to become weepy, ooze anything, if they develop in size, or if they become, very painful. They're the things that you need to look out for. And what I would say just with that one is I would pop a really high sunscreen. You can actually get ones over 100 in specialist stores and online. I would pop a really high one on that, okay, and just monitor it every month. It's not a cause for concern at the moment at all. I am just saying this purely as a precaution, okay? As I said, better to be safe than sorry, okay, but no cause for concern, I promise. Right, I think that is everything. So do you have any questions for me? I'm so glad. You are very welcome. honestly, I think with these things we can get a little bit caught up, and we look online and we convince ourselves we've got all sorts. 9 times out of 10 we are perfectly fine, but as with everything, if you're a little bit worried, it's always a good idea to come and see someone. Absolutely. Oh, bless you. So what we'll do is we will actually email all of this info over to you, so you've just got a record for yourself. If you do want to pop back in and see us again for that skin tag removal, if you change your mind, just book an appointment and I can actually perform that for you. Okay? Anything else I can do for you today? Positive? Alright then, well, it was absolutely lovely to meet you. Do you recommend us? Yes, we really do love recommendations and we have such positive feedback, so yeah, it's lovely to see a friend of a friend, as you say. Definitely. Okay, well, we'll send you all that info, and should you need anything else, you just give us a call. Alright, you enjoy the rest of your day. Bye then.